it's time for TIPisodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
A Tale of Two Hygienists presents this week's TIPisode, mini episodes giving you the tips to be successful, delivered straight from the experts. This week, sponsored in part by GC America.
My name is Rafael Rondon, and I'm the VP of Hygiene Operations for Coast Dental. I've been a hygienist for over 30 years, and in my last episode, I went over protocols that every hygienist should have in order to ensure that you're giving your patients the best standard of care. That included a peri-assessment, a caries risk assessment, and an oral cancer screening. By doing this, it will help you gather information to ensure you're providing your patients with the best treatment needed based on their needs. In this episode, I'm going to focus on the caries risk assessment protocol. In every protocol, you should include the entire team in the practice. If you have another hygienist in the practice, the assistants, the front desk, manager, everyone should be part of it. And I say this because everyone will be following the same process, protocol, and guidelines to ensure your patient is getting the same information pertaining to their risk level in the caries assessment. As you create your protocol in the office, you want to ensure you align yourself with the 88 caries risk factors. This will help you better determine the risk level of your patients based on the risk factors. These factors include poor oral hygiene, irregular dental care, orthodontic treatment, and the list goes on. You could go to the ADA website where you'll find the entire list of risk factors for your patients in your risk assessment. As you're creating your protocol for your caries risk assessment in your practice, keep in mind the goal is to help the patient understand the why you're going to be treating them by placing fluoride or even placing sealants based on the risk level. It is important that you keep in knowledge that when you involve your patients in the process, you will have better acceptance as to the patient receiving treatment. And to say, hygienists out there, that Dr. J.B. Black in 1896 stated, "The day is surely coming when we will be engaged in practicing preventative rather than reparative dentistry." That's huge, guys. To say that our technology, the fluoride that I hear from many hygienists out there that graduated many years ago, that they had to do so much work to isolate an area to place the fluoride quadrant by quadrant, and to say that now it's so easy by placing a varnish on patients' teeth to help them prevent them from getting decay. And as you can see, I have not separated children from adults. I believe that when you perform a caries risk assessment in your practice, is to see what risk level your patient is in, either low, moderate, or high. At that point, you will determine and develop a process of treatment for your patients to ensure you could help them prevent them from getting decay. Also be aware that this risk assessment should be performed at every visit because things could change. One visit, the patient might come into the practice and they don't take medication. The next visit, they come in and now they're taking a medication. And just know that there's 700 medications out there that could cause dry mouth. Yes, 700. It is hard to even remember the names and the brand names and genetic names they may have. But just keep in mind, if a patient comes to you with a condition such as heart issues, mood swings, pain, or allergies, and they're taking a medication for that, that may cause dry mouth. And your patient may not even feel that they have dry mouth. It may take about 60% of salivary flow deduction in order for the patient to start feeling the sensation of dryness. In the meantime, the patient doesn't feel the dryness in their mouth. At this point, us as preventive specialists, our job is to educate the patient and treat them based on their needs. In your caries risk assessment protocol, you should also include a tool or products for the patient to take home, such as MIPace or MIPace Plus. This particular product is amazing because it helps patients that have sensitivity, dry mouth, or are at risk for decay. The MIPace and MIPace Plus by GC America can be part of what you offer to your patients for home care. is a topical tooth cream that can be used to release vital nutrients into the mouth when and where it is needed. Getting the right nutrients is critical to staying healthy. TIPisode has the necessary building blocks for healthy enamel. We should educate our patients on the essential daily vitamins for our teeth that are important to protect and create that protective layer to buffer plaque as well as protect the nerve endings. And of course, we deposit those minerals. TIPisode has essential minerals like calcium and phosphate that will strengthen your patient's teeth. And of course, it will create a big difference in the overall oral health of your patient. It's easy for your patient to use and has great flavors. They now have a new member to the TIPisode family, which is TIPisode 1 Kids toothpaste, which continues to fight caries and rebuild enamel. And they come in great flavors for kids, which it will attract them to liking the toothpaste, which has bubblegum. They have a cotton candy and a blueberry flavor. In conclusion, when you're creating a protocol in your practice, such as a caries risk assessment, you want to make sure that you have all your data and guidelines and processes together, and of course, include your team in the process so everyone will be on the same page in communicating the same message to the patient. And of course, follow the ADA guidelines because it will help you better understand and better communicate the factors to your patients and to the reason of what level of risk they're in when it comes to low, moderate, or high risk. To make it easy on yourself, you could also go to the ADA guidelines and you will find a nice form that you could have for your patients to fill in, and that will help them understand also the why. Once a patient understands the why, your patient will be more receptive to receiving the treatment when it comes to receiving fluoride as a treatment or sealant as well. Remember, doing a caries risk assessment is being proactive and being a preventive specialist as you are to ensure you're providing your patients the services they need based on their risk level. Let's continue to provide our patients with the best standard of care, following the ADA and the Academy of Periodontology.
A tale of two hygienists.